Yeah, I chaired a really interesting debate about small cell lung cancer and whether radiotherapy still has a role in extensive stage disease. We had two excellent debaters, Professor Corin Fevre from the Christie and Professor Samreen Ahmed from Leicester, and had a really interesting discussion. With the advent of immunotherapy being added to chemotherapy as a new standard of care, the role of radiotherapy was debated, both thoracic radiotherapy and prophylactic cranial radiation. And it was generally agreed that there still is a role for radiotherapy, and it is important, both for the chest and for PCI, but it should be much more individualized and tailored to patients' needs. For example, in prophylactic cranial radiation, there's now evidence that that patients can do just as well with MRI surveillance. Unfortunately, in the NHS, not many centres have access to routine MRI for that level of frequency. Of course, we do have MRI, but to scan people very frequently that you require would put a lot of burden on the service. So I don't think that would be taken up widely. So therefore, I think most people still, with a younger, fitter patient, would still offer PCI in extensive stage disease. But I think there's a fair argument that actually, in many patients, that could be avoided. In terms of thoracic radiotherapy, again, we don't have the data now because obviously the whole situation is new with chemo-immunotherapy, and we will need trials, and there are ongoing trials looking at this important question. But again, I think the overall feeling of the panel and the audience was that thoracic radiation is still required in the majority of patients that have a good response to treatment with residual thoracic disease. So I think that was a general consensus at the end of the debate.